Hello there. We're here to talk with Robert Fraser, the founder of the CCSVI Hope Ambassador Society, a not-for-profit organization based out of British Columbia to help fund the treatment for MS patients. Hello, Rob.
Hi there.
I have a few questions for you.
Fire away.
Would you mind telling us a little bit about your disease history, your medical history?
Well, I had problems since actually about 2005 with my balance. Wasn't really serious, but on my last vacation in the Ukraine, I was falling a lot and having a hard time keeping up. So I checked with my doctor when I returned to Canada, and after a CAT scan, he said, well, you might have MS. That's what it shows. So he scheduled me for a talk with the neurologist and an MRI. Both of those treatment took 6 months, but they found that my diagnosis came back as having primary progressive multiple sclerosis, which is about the second worst kind there is. That was confirmed with a spinal puncture.
And what was the exact date of your diagnosis?
The official diagnosis came in May. I don't remember exactly which day, but in 2009. That's when the official diagnosis came.
And how they found out that you have multiple sclerosis? Is it a common method, or are there other ways to diagnose this?
Well, the most common way is actually through the diagnostic testing from a neurologist, covering everything from your balance to memory to cognitive ability, and right down to being confirmed at times with a spinal puncture when they actually withdraw about 3 test tubes of spinal fluid and analyze that.
And how did your confirmed diagnosis make you feel at that point?
Lousy. One of the reasons that it's so bad is that from the time of when it was originally spotted as probable with that CAT scan in December 2008 to the official diagnosis in May 2009, that left about 6 months of wondering why, oh, I've got MS. And it's a whole new aspect that opens up to the patient about, well, what exactly is MS? Because that's so unspoken of. And I find out that there was various types. You know, you always had this vision of the person in a wheelchair with MS, either that or crutches. And that's not always the case. That's not always the case. So, but that's really not a thing to look forward to. And it's, with no other options available, it really sort of takes its task on you.
I would imagine you felt an enormous sense of loss.
Well, the loss came with the fact that I used to be a pilot. After my diagnosis, I can't be a pilot anymore, obviously. I was had just a year prior to my diagnosis, I become licensed in 2 provinces as an emergency medical responder, and which is just just prior to going into my training as a paramedic, and that was lost. That was gone. I was also an equipment instructor, or lift equipment instructor, and that was gone as well once my diagnosis came through. With that, I was a manager at the time as well, and my cognitive abilities, memory, and vision impairments took place during that time, and I was basically opted out of that position. So I basically lost everything.
So do you feel you had to make quite a few changes to your diet and exercise on top of these things?
Well, at the time of diagnosis, that was pretty much a downward journey. And that went down the hill throughout 2009 and the beginning of 2010, before I had my first CCSVI treatment. It is my body was failing me no matter which way it turned. It was affecting so much that it was pretty encompassing and crippling to a point. Whereas you just don't know what to expect from one day to the next. There was, in fact, a time when I actually woke up out of bed and found out I couldn't walk, and that was scary. That was very scary.
Of course.
And to any other person going through this, because I'm not married, so I'm living by myself. That's really a sort of sort of being in touch with your own mortality, if you will. Okay, because you're just in question. What am I going to do? What am I going to do? And that's a prevailing question. And fortunately, at that time, it was an unanswered question.
Yeah. Like after any serious diagnosis, of course.
Yes.
So what is it about your diagnosis that halted all of these opportunities that you were presented with before your diagnosis?
Well, the halting factor was that the increase of symptom coming about. So everything from cognitive abilities, vision impairments, memory, balance, walking. It always used to be quite common that as I was walking along, this shoulder with a poor shoulder, because I clipped a lot of walls. Okay, but all of that adds up.
Yeah. So you had your first treatment in 2010?
I was quite lucky to get that. I was actually just checking for an email from someone I knew from out east. And when I saw that the Clinics of the Heart was giving a clinical or trial, I should say, to patients, and just to send in their info. And I, of course, just automatically went on the keyboard and just typing away. And I pretty well figured that I did not have a chance. Well, not, but I was lucky. I was one of 8 Canadians, actually, who was accepted for the clinical trial. I was actually the first from out west, being here in Victoria. The first one out east was from Nova Scotia. And it was absolutely great. My hat's still off to Dr. Morgell. He made a terrific change in me.
Oh, good. So what kind of treatment was this?
Okay, the treatment for the common CCSVI in multiple sclerosis is an angioplasty treatment, or what commonly called femoplastic. And it's the insertion through your femoral vein of a catheter, which will go up through your azygos, which is just behind your heart, and up into your internal left and right jugular veins. And when it's there, they will expand a balloon, which will reinflate your vein, and that's what helps a lot.
Is this the only treatment that can aid multiple sclerosis? Are there others?
There's pills, okay, which help at times. I do not take any. I refuse to. But those are really just band-aids. Most the CCSVI treatment, though, is what actually brings apart an increased quality of life to a patient.
And then you had your next treatment in 2011. What type of treatment was this? Was this the same treatment?
That was the same treatment. I had what's called restenosis, And that's just a recollapsing of those veins which they blew up before. And mine had collapsed, of course. And I fear that mine had also collapsed again because I have had a repeat of my past symptoms which have come back. So I'm sure that I'm going to have to go down for another one.
Do you have an expected date?
I would really hope to be there this fall of 2013, but of course that depends on finances.
And would you consider these treatments a cure,
No,
so to speak?
I wouldn't consider them a cure. They're not a cure. As a matter of fact, when Dr. Paulo Zamboni first came out with it in 2009, even he has stated it is not a cure for MS. However, that it would require further research. What it does, though, is that it gives the MS patient an improved quality of life, a vastly improved quality of life. The symptoms or the results actually come in three thirds. The first and third is fantastic results. The second third is moderate results, and the third third next to no results. And I fall probably in that second third, okay, as the moderate results. And I'm quite happy with that because I am drug free. And some of those drugs scare me.
Drugs are very scary.
Yes,
Absolutely.
they are.
So you definitely feel like the treatments are vastly beneficial to you?
When I went in 2010, when I went down to Mexico to see Dr. Miguel, I went down on a cane. When I came back, I was able to run again and ride my bike again.
That's amazing.
That's amazing. And that's more than any of these pills will give you.
Absolutely. So, branching on the point that this treatment is not available anywhere in Canada, is this why you started the CCSVI Hope Ambassador Society?
You know, Amanda, I probably, well, a little bit more than 30 years now. God, I'm aging myself. I was a soldier. And I gave my oath to Queen of Country, protect the people of this country. And I still hold that oath to a point. And when I see within our own country our MS patients being degraded the way they are, that makes me mad.
Absolutely.
And as an MS patient, that even made me madder. So that's why I made this society. It's not for me, it's for the other MS patients. I've had my treatment. I know what to expect. This is for them.
Absolutely.
Because not everyone can afford this treatment. So right now you're looking at an average of about $10,000 to be able to go to the U.S. or Mexico.
Even just
to get this
once?
treatment.
Per one treatment, it's $10,000?
Yes.
Aside from the financial burden that it puts on an MS patient, is there another reason you started the society?
Probably a more personal reason, because as an MS patient, you're looking at a very uncertain, if not negative, future. And even still, I still know that I have to go down for another treatment. But at least I know that. I didn't know that before. I had my first treatment, and that was never offered to me. Now I know, because this actually teaches you to be more in control of yourself and the multiple sclerosis which you have.
And for someone who's being first diagnosed, it's nice to have that sort of support system, especially.
Indeed, it is, yes.
Absolutely. So would you mind going into more detail about what the society offers to its members?
Well, if you check on our website, which is at CCSVI hopeambassadors.org. You can read up on our webpage and our all of our bylaws and so forth. What we offer to a patient is not certainly not medication. It's not being taken around by a bus or anything like that, or even strollers or whatever. But it does offer to qualified patients up to 60% based on what we have available of treatment costs. At this time of recording, we are waiting for our our charitable status to be returned.
Determine how much financial support one person might get.
Well, if they look on our website, they will see what we require, and that's quite lengthy. Okay, so what the requirements are, because that delves into everything from their financial abilities, what they have, what they demonstrated so far, what they're able to do, what they're not able to do, so on and so forth. It can become quite intricate. I personally, the society does not want to see a patient taken so far to the ground, if not underground, just to get this treatment. I would much rather see a person up above and still being able to survive post-treatment.
Absolutely, absolutely. So branching out on the point, is CCSVI, what exactly is that, and is it unique to multiple sclerosis?
Well, CCSVI, which stands for chronic cerebrospinal venous insufficiency, has been identified primarily in multiple sclerosis by Dr. Zamboni's treatments in Italy. It has always been speculated that for the last 170 plus years, that multiple sclerosis had a vascular input, and that was always ignored or overshrugged. Thank goodness Dr. Zamboni brought that to light. Since it's being researched now, unfortunately not so much in Canada, but elsewhere, it's been found that CCSVI exists in about, I think it's 43 other neurological disorders. And that includes ALS, or Lou Gehrig's disease, dementia, Crohn's disease, and the list goes on. Okay, and that's where so it's not exclusive to MS. It's only been made that way because of the events of the last few years.
And for everyone watching this interview, are there symptoms that can indicate a neurological disorder? If not MS, another sort of disorder?
Okay. The one thing with that is that if you have anything which actually gives you clinical importance, or more or less something which you would want to go see a doctor about. Well, that's how actually most MS patients are found. Okay, it's up to them to find out that they're, and usually by that time, they've already had it, like myself, for a number of years. It's just gotten progressively worse. But one of the most prevalent things is balance. You'll find your balance up. You'll find like an apprehension in going downstairs because your visual impairments have started, and your depth perception is put off. So that makes going downstairs sort of weird. Memory. Your memory will certainly go. Like I know that me, I'm getting bad again because my memory for names. If I haven't spoken to a person repeatedly for at least an hour, then an hour afterwards I will have forgotten their name. If I'm just newly introduced to them. Certain cognitive abilities, ways of thinking, well, are also in education. But that's not really, like that in memory and even vision is not something that you necessarily put clinical importance to. Mainly because it's not so apparent. Balance, however, is apparent. Okay, and that is what will that made me go to the doctor.
It was the red light that you needed, the indication.
Yeah.
Well, I'd like to thank you for speaking with us, and we'd like to thank you for watching. Be sure to visit our website, the CCSVI Hope Ambassador Society. Be sure to contact us if you have any questions, and take care of yourself. Thank you.